BiEst. What is BiEst? Bi meaning two, like bicycle, two wheels. Est, short for estrogen, EST. So BiEstrogen. There's two estrogens in BiEst. They are estradiol and estriol. Estradiol is probably the most popular estrogen commercially, also known as Estrace. There's a generic vaginal cream. There's a generic tablet, estradiol. Estriol is the least popular commercially in the United States. It's very popular in Europe and other countries. Estriol was commercially available in the United States back up until the 1970s. It was taken off the market, not because of safety issues, but because of economic issues. It's a very important estrogen. Our body makes both of them. I think both of them are very important. The importance of estriol, having estriol in there instead of just estradiol. Everybody knows the benefits of estradiol when it comes to osteoporosis, when it comes to decreasing hot flashes, when it comes to decreasing vaginal dryness, decreasing urinary incontinence, all kinds of other great benefits that estrogens have. Estriol is very important for vaginal tissue, including bladder. So it decreases incontinence, decreases atrophic vaginitis or vaginal dryness, especially when used topically. One of the great things about estriol also is it's a non-potent estrogen. It doesn't stimulate the estrogen receptor like estradiol. So it is non-proliferative in nature to uterine tissue, also to breast tissue. So with some of the scares of breast cancer that we get with estradiol that causes proliferation of tissue, estriol does not have those issues. In fact, estriol might be cancer preventative. How is that? Estriol is more specific to the alpha receptor, the estrogen alpha receptor, whereas estradiol is more specific to the estrogen beta receptor. We think that activating that alpha receptor decreases some of the cancer properties that can happen when estradiol is used solely. Now, the most important thing, obviously, is also use progesterone along with estrogen. But that's why I believe estriol should be given with estradiol. So BiEst is very, very important. Can be used orally, can be used topically. I like it vaginally because it works for local symptoms and is absorbed great systemically that way, but can also be used orally. So that is it on BiEst.